Hello, my name is Melva Covington. I am the co-founder and managing director of People Empowering People for Inclusion Now. We call that PEPIN. I, along with my co-founder, Tamara Allen, who is the Chief Visionary Marketing Officer, we're honored to welcome you to our Flash Talk series hosted by Ms. Mabel Hung. Pepin is a Chicago-based African-American female-owned research, recruitment, and technology firm focused on delivering high-tech and high-touch solutions for clinical research, focused on reducing health disparities, improving inclusion, and achieving health equity. There's an exclamation point in the center of our name because it expresses a sense of urgency in addressing the issues of inclusion as well as reducing disparate outcomes. Our value proposition is simple and straightforward. We aim to do three things. The first is to increase inclusion in clinical research. The second is provide evidence and insight that's scaled by digital technologies. And the third is to leverage community-based input and engagement to achieve solutions for research participation, health policy, and better access to innovative care. We do this by building empowered networks, empowered study partners, and empowered data systems in the work that we produce. Now for today, we aim to bring you insight from an innovative leader to discuss their work in science, digital innovation, or healthcare solutions. So we welcome you to sit back, take some time to breathe, and enjoy our Flash Talk. We appreciate you, and we thank you very much.
Hey everyone, welcome back to another Flash Talk as a part of the PEPIN Flash Talk series. Once again, my name is Mabel and I'll be hosting today's Flash Talk. So today we will be joined by Dr. Shauna Thompson, and during our conversation, we'll be exploring some critical issues in maternal health and discuss insights in how we can approach care and improve outcomes. So allow me to quickly introduce Dr. Thompson. So she's a transformative physician executive and senior medical director of clinical network development at Mount Sinai Health System. She has extensive leadership experience across multi-specialty care systems, digital startups, and academics and community healthcare. She's also dual board certified in obstetrics, gynecology, and obesity medicine. She specializes in clinical integration, change management, and innovative care model delivery. As well, with an MBA and MS in healthcare leadership from Cornell, Dr. Thompson also serves as an adjunct professor at NYU Wagner and a keynote lecturer on innovation. So really through these diverse roles, she's driving meaningful outcomes and advancing healthcare through her expertise in telemedicine, digital health, and quality improvement.
And it's so exciting to be here today. Thank you so much.
So I guess starting off, if you can tell us a little bit about your background and just something that kind of unique about you that you want the audience to know about you.
Yes. So I think, I can probably combine the two of those things. So I'm an OBGYN and I'm an obesity medicine specialist. And in my career, I've been very fortunate to work in various areas of this lovely country. I've worked in urban, suburban, rural, academic, community settings, which really helps me to broaden my perspective on the care delivery in the various areas. In terms of what I think is unique, the one thing I'll point to is obesity medicine. So I'm an OBGYN, and some people think of, why on earth would you do obesity medicine? When I worked in Grinnell, Iowa as an OBGYN, I was the only OBGYN for a town of 10,000 people. It was an amazing time because in that area, what we had to do was maximize our resources to deliver the care that was necessary. We had general surgeons who did C-sections. We had family practitioners who also delivered, and we all together was able to take care of our population. The one thing in my first few weeks of practice, I diagnosed around 8 endometrial cancers, and the common theme with endometrial cancer is obesity. So this was back in a time before the amazing medications that we have now. I took it upon myself to learn as much as I could about obesity medicine, because that was going to be influential in changing the trajectory of whether it be endometrial cancers, infertility, polycystic ovarian syndrome, diabetes. That was impactful in changing. So I took it upon myself to learn more about that field.
Wow, that is definitely an incredible journey, and it's clear that kind of shaped some of the work that you do today as well. Yeah, and then just, I guess, digging a little deeper and wondering, what is it about this work that kind of makes you passionate and keeps you motivated when you go into work every day?
So the beauty, I am a women's health provider. Women spend a lot of time taking care of everyone else but themselves. And so oftentimes I say, when you're in my office, I'm going to take care of you. I can't tell you all the time, before the visit, after the visit, most women clean the room. They're folding their gown. I said, no, none of that here. I'm going to take care of you. And so I'm fortunate to take care of women throughout their journey. Whether it be adolescence, childbearing, postmenopausal, and beyond. And the one thing that I will say about the women's health journey that's perhaps a little bit different than other specialties is that the time around pregnancy, often this time is a litmus test, or really a stress test for what the risk factors are later in life. And so I often highlight the time around pregnancy as a time to really take stock, to be as healthy as possible. And a lot of times these habits or behaviors that we develop around the time of pregnancy are ones that are going to be protective as we move on. So I really focus on adapting some of the more healthier behaviors. Because at the time that women are so used to taking care of themselves, they want to take care of their babies, and then I can help them take care of both mother and child.
Yeah, I think that's super important. A super important piece is that self-care, and how women is all about, sometimes focusing on caring for other people, but doesn't have the time and effort to kind of, focus on themselves. So I think that is something that we should all focus on in terms of when we try and provide care for women, and to empower them to really focus on caring for themselves. And I think, I imagine that passion really helps you navigate some of the challenges in your role as well. But just wondering if there's any, unique difficulties or challenges that you face in your role as an OBGYN that you really wish that more people understood.
Yes, I think there's a lot of different challenges. I think the most important, there's a lot of different aspects to what's important. However, the care that I do, we all realize that as providers, the care we give is only 20% of the story. 80% of the story is, we call them social determinants of health, but it's the community. It's the ability to access transportation, to access food. Can one keep their job while they are pregnant and doing various visits? Can they keep their job afterwards while they are postpartum? And then can they keep the trajectory? So I try to maximize as a provider the care that I give, but really full knowing that it's only 20%. There's so much else that we can do, and how do we affect that? It's public policy, it's laws, it's making sure that people have access to their medications. They can pay for their medications. They can take the transportation to their visits. So I think that's another aspect that maybe a lot of most people don't really understand. And so most of us, I always say we should do whatever we can in our power to advocate. So advocacy is hugely important, and for all of us, it looks a little bit different because we have a little bit different resources and circles. But the advocacy is what's going to help to improve the care that we deliver.
Yes, that is a very important perspective. And I think speaking of advocacy as well, something that often comes up is that patients may feel very powerless in some of these medical settings. So kind of throughout your experience as a healthcare provider and advisor, how do you recommend, patients can better advocate for themselves during some of these appointments?
Yes, advocacy in the empowerment is really important. So the one thing I think is very interesting is that when we buy a car, and frankly, when we buy anything, we look at reviews. Most of us are very consumer savvy, and before we purchase anything, we've reviewed everything, maybe even done a price check to make sure we're getting the best price for our service, and so what I think about is before even stepping foot in the office, one should do that review. Now there's so much information available online. Probably one could even use ChatGPT to analyze what place is better for them, because we're all different in terms of our medical history background. But I recommend being a consumer. Now, even in healthcare, we are moving. I don't want to say we're moving away from human-centered or patient-centered, but we're realizing we need to be consumer-centric. The difference between a consumer and a patient is how vertical one is. So we really have to think about these various areas, because when we go into the office, we are standing, so we should make sure that we put those consumer hats on. So I think that's the first thing. The other thing is we really have to understand what we want to get out of the appointment. Yes. I think that's number one. We're at a time now that most of us can research what should happen if one is a pregnant patient. What should happen at every single visit? If one has menopause, one can research what's going to happen in the various stages. And it is up to us to do, as patients, to do that research before coming in, because the provider, everybody's under constraints. We don't have the beauty of an hour to talk about all these different things, but that's not to say that all these different things aren't important. So I think coming in with research being done, an agenda, one has studied the outcomes, the consumer reviews, and everything's plus or minus, but reviewing the consumer reviews before one steps in the door, that's really important. And then I do recommend, it takes a village. It takes a village to take care of ourselves. So I recommend having an external healthcare partner, external from the healthcare organization, meaning family, yes, or somebody else that can help navigate. Because oftentimes when you're hearing diagnosis or hearing different things, it's really hard to focus on all the different aspects. You need somebody who's a little bit more objective, who can say, oh, well, what about this or what about that? Or even to take notes, because sometimes we won't remember everything that's being said at a visit. So I think those are the top ways to advocate. Of course, there's more, but I think a lot happens before walking in the door.
Yeah, and I think those are definitely very actionable steps a lot of patients can take for themselves, before attending an appointment, just taking some time to do some research and finding that support, whether it's their family or friends. So yeah, thank you for sharing that. And I think continuing on kind of the topic of advocacy, one area that also seems to lack advocacy is kind of research involving pregnant women. And that's something that's often overlooked as well. So again, from your experience, how can research address some of these disparities in maternal health outcomes, and why is research important?
So there's a few sayings that we have, but the first one I'll start with, and I think it was by one of our congressmen.
Okay.
In God we trust, but everybody else bring data. So so research really helps us to know what we don't know.
Yeah.
We can't just assume certain things. We need to have the data to back it up. And then the other thing I say is that if you can't measure it, you can't fix it. And so it is really important to invest in the scientific engine, the collection of the data, the analyzing of the data. I think a lot of us now in our AI generation have realized, wow, there's a lot of data being collected all the time. And healthcare organizations actually have collected data, since the beginning, but no one's ever known really how to put it together. And now through AI and the Amazons of the world, they're able to put it together and actually create, if you will, a digital profile of yourself. So there's this other digital you that exists. So in healthcare, it behooves us. It's really important for us to be as sophisticated. And in order to be sophisticated, we have to invest in collecting that data, in doing these studies, in looking at, we haven't been as robust in looking at our diversity, in looking at, in analyzing how our racial background is influenced, right? Or vice versa. There's influence of racism on care. And then there's also cultural aspects to care. So it's an exciting time, I think, to be in healthcare, because we understand that we need to start doing this data analytics, putting that picture together to create a better digital profile of our consumers, of our patients.
Yes, exactly. I think as we recognize how important data is, and not just data collection, but how do we exactly leverage that data to help patients and build those profiles. So I guess just on the note of technology as well, it definitely has become a tool in healthcare. And as we think about addressing disparities as well. So how can we kind of design maternal mental health care approaches that leverages technology as a facilitator, but still ensuring that kind of human piece, that human-centered care, and being able to be aware of some of the limitations of technology?
Yeah, I think this is an amazing question, and of course I don't have the answer, but I do think there's aspects to it that we really have to think about. One thing that we really have to be cognizant of and careful of is that we don't want the technology to make things worse. And so now there's ethics in AI. There's conversations of various tools have been brought out there that we've seen actually created greater gaps and greater disparities. And so it's a time that we need to really test what we're bringing out there to make sure that it's not increasing the gaps. The other thing I think is really important, and I might be in a small minority in terms of this, but the human contact, the human interaction is really, really important. And the human checks and balances, I think, are really important. And one of my greatest examples is that you can use Siri to get anywhere, which is lovely. You can use it to navigate, but then sometimes Siri says, go left, and you're like, that's a pond. I'm not going to go into the water right now. No. So having that ability to have data to guide, but still being able to as a physician, to put the clinical picture together, to put all the 80%, the social determinants of health together as I'm seeing this individual person in front of me, is still important. And we're not there with our technology such that we can trust that it will make that decision for us. So right now, that human interaction is hugely important. The other thing I will say is that tech, being innovative is not always the most technology, the most tech-enabled aspect that you want to apply. Sometimes innovation is really putting two ideas together and removing and making things easier and removing barriers.
Yes.
One of my most favorite innovations, if you will, I heard in a TED talk, and
Okay.
it was by a psychiatrist in Africa, and they talked about access. It's one psychiatrist to like 3 million people, and I'm sure that number is not correct. I think it's higher, but I wanted to hedge. I wanted to go a little low. So really, 1 million, one psychiatrist to 3 million people, and the 3 million people can't travel to get to that one psychiatrist, and that one psychiatrist can't go everywhere, right?
Yeah.
And so this psychiatrist created an innovation using grandmothers. So luckily, grandmothers exist in all markets, and grandmothers, usually want to come, help and give back. But the innovation that he created is that he taught these grandmothers, of course, a pilot, and then got larger, taught these grandmothers just cognitive behavioral therapy, really simple therapy, and put them on a park bench in the local communities.
Okay.
So there's communities, exactly. You have your communities, you have care that's local, and you put them together. And people, when they needed something, would go to the grandmother on the park bench. And this program exactly was phenomenal. He had so many stories of people who came and they were desperate. The one story he gave is a woman who had HIV, had 2 children. Her husband just left her, and she didn't know what she was going to do. She was devastated, had no resources, and through working with a grandmother on a bench, of course, multiple visits, now this mother was in school, had a job. So there aren't words to talk about how phenomenal that is, and that's very much innovation. So using the resources that we have, removing barriers, making it easy to access care, it can be innovative.
Yes. Yeah, that's very fascinating. I think I have to go watch that TED Talk. Yeah, that is an incredible example. But yeah, I definitely think even though technology has a lot of limitations, there's definitely a huge potential for disruptions in the healthcare space with technology, but we still have to be aware of some of the kind of interconnected factors that technology cannot fully address. So yeah, and then again, on the topic of interconnected factors, maternal health also is hugely affected by, mental health and also support systems. So kind of last question here, what role does community and family support play in maternal health, and how can healthcare systems really account for those varying levels of support?
Yes, this is really important, and I think we're starting to see just how important community is, because when you think about it, especially when one is a first-time mother, and very much when a mom has had multiple children, maternity leave is perhaps the most difficult leave for many women, because the times of a one-job family are really no longer here. Most families, if they have 2 partners, usually both partners work. And when one is, especially postpartum, it's so difficult. So you're taking care of your child, trying to take care of yourself. Maybe there's other children. And these are all, and then you're thinking about, oh my gosh, our finances have decreased. Maybe one has some coverage, but usually it's decreased. It's not at the level as it was before. And so there are financial pressures. There are emotional pressures. I mean, it's a perfect storm for depression, withdrawal.
Right.
It's a very, very, very hard time. And I think we're starting to realize for a lot of people that's difficult.
Yes.
Personally, I often found maternity leave my most difficult time. It was so much easier to be at my work, at my job. And so the things I think that we could do more of is every family after one has delivered really needs a nurse. It's been something that those who have more resources, more affluent, have had. Oftentimes they've hired a baby nurse. Well, this is something that everybody could use, because the beauty of having somebody available to check on one in the home is that it helps with safety. It helps with continuing to analyze how one is doing mentally, how the family is integrating in this new environment. And also then one can feed back to the physician and the healthcare organization. So again, it's an innovation that is not tech enabled necessarily. One is not being monitored and watched at home 24/7, but there is that partnership. And there's that support. There's that, if you will, it's almost like somebody sitting on a bench in your home, so that you have someone to talk to as one is going through these changes. So the community, the human aspect is so important. And then tech can definitely help to facilitate the communication. One can put this information through Epic, and algorithms can be drawn to see how at risk somebody is for depression, and whether or not they need to enable even more services for the patient or spouse. And so the more we look at us as healthcare organizations helping to shape that community around the family, I think the more successful that we will be in elevating our level of care, and not just thinking about the 20% of the time that we spend with the patient, but really thinking about, putting a full blanket around the patient and thinking about the 100%.
Yes. No, that's super important. That makes a lot of sense, focusing on the family as a whole and kind of the impact overall. And I think today is just, there's just so many, again, factors and things, that can happen, and unexpectedly as well sometimes for these families. So I think what you said definitely resonates with a lot of mothers and families out there. So yeah, that's super great. So that kind of wraps up our flash talk for today. I know I definitely learned a lot, and that was incredible. You shared a lot of interesting stories. I'm sure people will really, really enjoy listening to. So thank you, Dr. Thompson, for hopping on today and sharing a lot of your insights and journeys with us. It's been great.
Thank you so much, Mabel.
Yeah, I guess, everyone who's here. So thank you so much for tuning into our conversation today. We really hope that you found it valuable and inspiring. Please, stay connected with us on LinkedIn for updates and future events and more flash talks to come as well. And thank you again. And we really hope to see you at some of our future events.